Hello everyone, I welcome you today to yet another wonderful episode where we're discussing about appendicitis. So in this video, I'll define what appendicitis is. I'm briefly going to talk about the anatomy, the types and causes of appendicitis, the clinical presentations, the complications, and briefly the management. So what is appendicitis? So appendicitis is simply the inflammation of the vermiform appendix. The inflammation of the vermiform appendix. So the appendix is located in the right iliac fossa, right at the terminal end of the cecum where three tenia coli join. This is where we find the appendix. And the main blood supply to the appendix is the appendicular artery. So the appendicular artery comes from the ileocholic artery, so it's a branch. It branches off from the ileocholic artery, then the appendicular artery, which happens to be an end artery. So what gets to happen is that in instances where the appendix becomes gangrenous, the appendicular artery is thrombosed. Okay, it gets blocked, and we see many more other complications that we are going to discuss in this video. So what are the causes and risk factors of appendicitis? What might cause this appendix to inflame? So there are a lot of explanations to it, but I'll try to summarize some in this video. So there is a racial and dietary explanation to this. So it has been seen that appendicitis is common in white people and mostly male children. So this is a cause that has been seen as well, probably because of the nature of food our friends eat, and there is a correlation of appendicitis to eating high refined carbohydrates as well. I'm pretty sure that could explain it. There is a familial explanation to this as well. So it has been seen in studies that there are certain individuals who are prone to having a long appendix. So when someone has a long appendix, what gets to happen is that right at the end of that appendix, there might be less of blood reaching there. Hence, this might trigger an inflammatory process. It might cause a gangrenous appendix to occur because of the insufficient blood flow reaching to that area. Another explanation to this is the obstruction phenomena. So this is an appendix which might be blocked by something. It could be a foreign body, it could be a cancer, it could be a fecalith or a hard stool. There is as well a non-obstructive explanation to this cause of appendicitis. So this is where just inflammatory processes cause a blockage in this appendix, probably because this inflammatory process has been recurring, it has been occurring, and it has caused adhesions and scars in that region. Hence, someone might continue to have this picture of appendicitis, but it's non-obstructive in nature. So what are the types of appendicitis? So appendicitis can be acute non-obstructive, like we have discussed. So due to the inflammatory processes that are going on in this appendix, there's no obstruction, but because of the secretions that are occurring in that region, the inflammatory processes that are going on in that area, this might cause an appendix that is inflamed. But this one is less severe. The other type of appendicitis is acute obstructive. Remember, we talked about acute non-obstructive. Now this one is obstructive and actually more severe. So this is where we find the appendix is obstructed by something. Like we mentioned, it could be a foreign body, it could be a fecalith, it could be a cancer, or anything that might cause a blockage in that area. The other type of appendicitis is recurrent appendicitis. Recurrent appendicitis, probably because of a retained stump of an appendix. So in cases where someone has a long appendix, this is a patient maybe who might have had undergone an appendectomy or a laparoscopic appendectomy, and now there is that stump that remains. And now because of this stump that remains, it continues to give those signs and symptoms of appendicitis. So it gets to be recurrent in nature. So briefly, those are the types of appendicitis. So the common symptoms we're going to see in someone we're suspecting to have appendicitis is migrating umbilical pain. So this is a patient who might come in with a complaint of this vague umbilical pain, which later on migrates to the right iliac fossa. So just that is a very cardinal symptom. The other thing we might see is diarrhea. Someone might have vomiting as well. They'll have anorexia, which is also called hamburger sign. So why hamburger sign? If someone has anorexia, they don't have that appetite to eat. They won't even have an appetite to eat a hamburger if it was to be brought before them, hence the name hamburger sign. So these are patients also who might be constipated. So these are patients who might be constipated. Others might have diarrhea in a case where this the appendix that is inflamed is positioned in the pre-ileal or post-ileal section. So there will be irritation to that ileum, that small intestine that is there, causing diarrhea. So the other cause of appendicitis, or rather let me say the other symptom and sign we might see in appendicitis is hematuria. So why hematuria? See, this is an appendix that is located in the region where there are so many delicate organs. You have your ureters there, you have your bladder just near to the cecum right there. So if there is an inflammatory process going on, this might irritate the bladder or the ureters, hence someone might present with bloody urine. What are the key signs to notice and really elicit in such a patient who we suspect has appendicitis? So one of the signs we can elicit on examination are one, the McBurney point tenderness. So the McBurney point is a line, is a point in the lateral 1/3 of the right iliac fossa. So you draw a line from the umbilicus to the right anterior superior iliac spine, then you divide this line into 3 parts. Now the lateral 1/3 of that line is where the McBurney point is. So this is a line that is corresponding with the position of the appendix. So the other sign we want to carry out in this person on examination is Rovsing sign. So when you palpate the left side of when you palpate the left iliac fossa, there'll be pain felt in the right iliac fossa because of the shift of the bowel loops. So there'll be those intestines in between that will irritate this appendix, hence someone will feel pain. The other sign you want to elicit is psoas sign. So with psoas sign on extension of the right hip, we see pain on extension of the right hip. Remember, the muscles that are being really triggered in this case is the psoas major muscle. So this psoas major muscle is involved in the flexion of the hip. And so once you extend it, it's causing an irritation to that inflamed appendix. The other sign you want to elicit in this person is obturator sign. So obturator sign is elicited by internal rotation of the right hip. Remember, there is the obturator internus muscles also that are being triggered in this instance. So in a case where someone has a retrocecal appendicitis, that appendix will be irritated due to the movement of these muscles. So any of those can point us to someone having appendicitis. What are some of the investigations that you can do to confirm your diagnosis of appendicitis? So we can have radiological and laboratory investigations. So some of the radiological investigations you can do are an ultrasound, an MRI, and a CT scan. And mostly the prominent finding in all these investigations are an appendix that is inflamed and edema around this region. Some of the laboratory investigations we can undertake, one, a full blood count. Yeah, so in a full blood count, what are you expecting to see? There will be leukocytosis. Okay, we might want to do a C-reactive protein as well. So C-reactive protein is simply an inflammatory marker. So in most cases, it will be elevated. We also want to do a urinalysis, which is a bedside investigation. So we want to rule out any urinary causes. Is this a UTI? We want to really check for leukocytes as well, which we might see that there might be pyuria. This patient might be having pyuria. So one thing that is cardinal to understand is that the diagnosis of appendicitis is broadly clinical. So it's from your clinical findings that you'll be able to establish a proper diagnosis. You see, the investigations might be normal. The findings on your radiological findings might be unremarkable. But if your clinical findings are so prominent, then that should pin it as a diagnosis of appendicitis. You shouldn't always depend on the backup investigations. So the management of appendicitis is broadly surgical. So within 24 to 48 hours of this person who has been diagnosed with appendicitis, you've confirmed everything, they are expected to undergo an appendectomy within 24 to 48 hours. But before you undergo this is a patient who might need resuscitation. So you might want to check for their airway. Is their airway patent? Are they breathing properly? Do they have a proper circulation? Because this is an emergency. It's an acute kind of a condition you're dealing with. So you'd want to resuscitate them. How is their hydration status? You want to administer some fluids, probably normal saline or Ringer's lactate. So the other thing you'd want to do in this patient is to initiate antibiotic therapy. So depending with the treatment guideline where you are, you would want to start some antibiotic therapy, some empirical treatment, and probably you would consider doing culture and sensitivity tests for this patient. So this was our discussion on appendicitis. I hope it was very helpful. It was just an overview. Obviously, there's more we could have alluded and discussed, but I hope this overview of appendicitis has given you an idea of what appendicitis is. Thank you so much for tuning in. It's goodbye for now.